easily the easiest insole with the best benefit that I've given to people. I mean, I basically describe it as, instead of providing an artificial support, we're going to get something to make your basically your endogenous stabilization system in your foot work there, and that's going to stabilize your your entire body, really.
I am Dr. Jim Clough, and we're on the podcast entitled The Power of the Feet. Today we have the privilege of talking to Dr. Sheridan Jones. He's a chiropractic physician in Helena, Montana at Align Chiropractic Clinic. And Dr. Jones, I went on your website and you have a lot of credentials. You are amazingly well-trained chiropractic physician. I have been trained in lower extremity ART, and I know what's involved with that program. But for our listeners, can you explain what that is? And you're full body certified in ART, which is quite an accomplishment.
Yeah, sure. I mean, that's kind of a good segue, because that's honestly how I stumbled onto the Cluffy Wedge initially, and then eventually the insole. ART stands for Active Release Technique. Their taglines is simply the best soft tissue treatment. They've done a tremendous amount of research to back up what they do as far as their protocols for treating different conditions and tissues. But basically, what we are trying to do is get to the root cause of any neuromusculoskeletal disorder, find that tissue that is actually problematic, and address that tissue directly. We're Montana, right? So sometimes firearms are an easy way to describe things. So instead of using a shotgun, we're using a sniper rifle. We're getting right to the root cause. And I use it a lot in conjunction with the functional movement systems, selective functional movement analysis, or SFMA. That philosophy basically says, address what kind of problem this is, whether it's a stability or mobility problem, and we attack it with the right kind of correction based on what category or bucket that it sits in. Utilizing SFMA analysis there, and then applying a lot of active release techniques. That's kind of what I do all day, every day. Some of the other things that I do with like the Titleist Performance Institute, they really use the selective functional movement analysis for creating the body swing connections. Even though I'm, maybe in a little more of a golfer hat at that treatment, if you will, I'm still using the same analysis and the same treatments a lot of the times that I'm using on just anyone who comes into the office.
So you really incorporate a lot of these very advanced techniques to identify problems in the body, lack of mobility or too much mobility, and then you're addressing that specifically with active release technique, mainly in your treatments.
Yep. Yeah, absolutely. And it's, as kind of continued to learn more, even if I'm at a different type of seminar, you kind of get to the realization that's, when these people are good and they know what they're talking about, we all might be saying the same thing differently. Where I think the best of the best, and when it comes to physical medicine, they have a real good understanding of why things are happening. They may describe it a little bit differently when you get into some of the different, schools, whether it's, dynamic neuromuscular stabilization, or, some of the other offshoots of, treatment. But really they, all have a great understanding of human movement, and how we, as providers, need to restore that human movement in order to have a successful treatment to the patient.
Yeah. Yeah. So as a podiatrist, I went ahead and did the lower extremity ART, and I was surprised at how involved that is. And you're required, I think, yearly to become recertified or updated on that. Is that correct? So it's quite a commitment.
Yep.
And talking to the leaders in the field about differences and what's changing in that, and staying abreast of the latest techniques. And that's great. Yeah. So, when did you become aware of the Cluffy insoles and the Cluffy Wedge?
The Cluffy Wedge, I'm thinking is probably right around 2021 or so. 2021 or somewhere in there. I was in Great Falls at our, mutual colleague, Dr. Stobie's office doing a training and for ART. And we were doing the lower extremity ART. And as we were working on different intrinsic muscles of the foot and lower limb, we identified, multiple members in the classroom that had dysfunctional first ray. So that was, he drew them in the shoes and stuff like that. So that was what kind of got me going down that rabbit hole. At that time, I was at a different office, but I was fairly soon to open up my own clinic. And as soon as we opened up our clinic, that's when I really put them into place for all my patients that are candidates. There's a vast majority that are
No.
the. I mean, it's been a huge success. It's easily the easiest insole with the best benefit that I've given to people. I mean, we at our old clinic we had some, Dannenbergs and Superfeet and different things like that. Back in the day, I used to do the foot levelers thing. I've had some that I've sent in and they got casted, and I mean, just the only one that ever came, you know, close was one that I had another physical therapist. He casted an individual that did really well when I started doing balance tests and stuff like that. But I asked him, what'd you pay for this? And it was close to $1,000 once it's all done. You know, it's not really even comparing apples to oranges at that state.
Yeah, how many people? What do you think your percentage of people is coming in that have a foot disorder of the patients you see, Dr. Jones?
The I've gotten to the point where I will screen everybody. I mean, my
Yeah.
first thing that I'm doing when I'm seeing a patient is I'm screening them with a SFMA chiefly there. But then as I break out into more special testing and stuff, I look at that first ray, and especially if I got anybody that they fail a deep squat or they fail a single leg balance, any of those things, that's my immediate thought is like, I'm going to be putting these in people in Cluffies by the end of the day. Um,
Yeah. How do
as
you
far
how do
as
you tell your patients about the insult? How do you present that to them when you're giving it to them?
Um, I basically describe it as instead of providing an artificial support, we're going to get something to make your basically your endogenous stabilization system in your foot work there,
Mm-hmm.
and that's going to stabilize your your entire body really. If you have a knee problem, a pelvic problem there, even going up into a spinal or cervical problem, if you start on a bad foundation, I think that's just setting yourself up for failures. What I usually do is I screen them. I check the dorsiflexion of that uh, foot there, and then I check the dorsal flexion when it's loaded of that first ray. And I mean, there's a high percentage of them that have bilateral, but even like the unilateral restrictions, I typically put them in the Cluffies because I'll do a balance test or something on them, and they see how much improvement they have, and they're like, well, I want to I want to do both. That's
Mm-hmm.
I would say there's in our practice there, and we have two chiropractors and massage therapists right now looking at another providers here shortly. There's 65% of those total patients that are in Cluffies.
Wow. And how are you finding that they work? I mean, if you have somebody with foot problems, it's an obvious answer to most of those. But how are you finding that they work for some of your other problems? You mentioned you use it really holistically with your SFMA evaluation to try to improve mobility. So these are helping with different conditions other than foot problems, I'm assuming, right?
Yeah. I mean,
Mm-hmm.
yes, especially like this time of year, we see a ton of, kind of patellofemoral people there. It's
Mm-hmm.
nice. They're out, trying to, you know, be weekend warriors doing a Spartan race or something like that. And they
Yeah,
come in with, searing knee pain. So
yeah.
that that's kind of my first line there. I do usually a single leg squat evaluation, functional evaluation, with all my athletes. It's kind of funny. It's the end of the school year, but I'm doing a bunch of pre-participation physicals for high school kids. And these big, strong athletes, they're failing all over the place in their single leg squat, and you get them start evaluation. And it's like, well, yeah, not only does your, hip abductors suck, but your foot sucks. So we need to address both. So, and I
Yeah.
usually kind of tell people that, it's like, sometimes that reductionist type thing there, has kind of plagued us there. I want to get to the exact problem, but I want to treat, I want to treat everything. And the nice thing about this is this allows me to do a lot of things that, would take more time traditionally than now I can do some ART on the individual. I can put them in Cluffies, and they have really good results. Some people, if they're wanting, to really work on performance type stuff, there, I might do some other type of stuff that like Tom Mashad is kind of spoke about and different things. But just strengthening the foot, I think the Cluffy is a great kind of way to get in the door with that. I mean, literally, if they're walking purposely in good footwear with the Cluffies, they're going to be exercising, and using that windlass mechanism throughout the day, and really kind of retraining everything from the ground up.
Wondered if you had a chance, Dr. Jones, to try this with any different athletes and noticed any performance improvements or feedback from them regarding the insole.
Oh yeah, we've had lots of some collegiate football players. Had a collegiate basketball player trying to break into the collegiate cheer, because just off of the work that you've done with the University of Montana cheer squad, it's been a really I think it'd be a hugely beneficial thing for these people, especially when you look at some of the um, incident rates of TBIs with females. Don't have it right in front of me, but I want to say cheer is like top five as far as the incident of concussion and TBIs. So if we can do anything to help minimize those through more stability, better balance and stuff like that, I think that'd be a great thing. Not for just their performance, but for the um, ability for them to stay in the game longer without injury. Golf is obviously my thing that I have the most experience with. So that's what I implement these insoles on mostly, and most of those individuals notice you know less fatigue after rounds. Some will relate better club head speed, but they feel so much better. And I mean, especially if I got a golfer that's having some sort of like plantar fasciitis or some sort of Achilles tendinopathy, they can't believe it. I mean, most of those people are the first day you put them in, they come back and they're like they wouldn't even believe it if you told them. If they didn't experience it, they would never believe it.
Excellent. Good to hear. Well, Dr. Jones, thank you very much for being with us today. We appreciate your time. Would you give the listeners your contact information if they want to call you to see you for a consultation? Would you be able to do that?
Absolutely. Yes. So we have a fairly easy online booking platform at our website, which is alionhelena.com. Our phone number is 513-1403. And you can email me directly. It's drjones at alionhelena.com. And yeah, it's, definitely, we're get you hooked up with, all of our expertise. And we always carry,
Mhm.
every size of Cluffy that's available. So we can always get you hooked up there too.
Well, Dr. Jones, appreciate all the care you're providing for people. You're doing a wonderful job. Thank you very much for your time today. So we'll look forward to talking to you again sometime. Okay.
Yeah, I appreciate it, Jim. Thank you so much.